My name is Ram Shrestha and I'm working for an organization called University Research Company since 2010. I lead an unit called Community Health and Nutrition. This approach came about through my work in Nepal. When I worked in Nepal, I developed a model to motivate and mobilize the female community health volunteers to provide primary health care services throughout the country. The problem we ran into was that community health workers could not reach every single household by herself. She needed help to know what children were sick or which women were pregnant. Communities already inherently form systems. These systems are composed of community groups, social and religious leaders, school teachers, local chief, and health facility staff. Community health workers need to be a part of this larger system already in existence in communities. By tapping into this system, the community health worker can reach to all households and also strengthen the linkages between the health facility and the community. The implementation of this model in Nepal resulted in maintaining the motivation of 50,000 volunteers for more than 2 decades. At URC, through USAID Healthcare Improvement Project, we are testing this model in Ethiopia and other countries. Recently, we have been testing this model in Ethiopia. One of the health extension workers will tell you about the process of implementation in her kabele.
Hello, my name is Abubek. I am 25 years old. I am married and I live in a village in Ethiopia. My education is grade 10 and my profession is health extension worker. In my village, families have been suffering. Babies are born premature, sick, and malnourished. A great number of infants don't even make it to their 5th birthday. Sometimes mothers die in childbirth or even before because of complications. Our village elders have met many times to try to find solutions. Our council chief has sought advice from each of the village councils, and he is very worried about the future of our community. In 2005, there were 123 child deaths per 1,000 live births alone, and 673 women out of 100,000 died in childbirth. The lawmakers have been trying to help us to have healthier families. I decided to help. Our government offered training to becoming a community health worker. Here they are called HEWs, or health extension workers. After 1 year of basic health training, I became a health extension worker, and I was so proud. I had a small health post for an office, a stethoscope, and other tools and aids for my new position. The new adventure did not turn out as I had expected. The women of the village did not welcome me with open arms. They thought I was pretending to know about raising a child when I had not yet had one of my own. They refused to answer the door, and sometimes they would even send their dog out to chase me away. It felt terrible. I sat in my health post all day without one visitor. I was so discouraged. I talked to my supervisor at the facility and she consulted with the district health management. The district manager came to talk to the village chief so that he and the elders might help me and might help explain to our community how I can help them. Now our village chief has introduced me to all the village councils and asked them to help me with my work. They invite me to their meetings so I can explain to them how I can help their families. They have started bringing me information on the women that are pregnant and the recent births, and even on the problems that young mothers are having. They are also sending their families to come for appointments at the village health post. I teach the women about healthy nutrition. I record and track their health information. I take them to the health center for their checkups, and I monitor the pregnancies and the health of their newborns and infants. I even show them ways to care for their families. We are becoming real partners. The village elders feel much more confident in the future of our people. And I do too.
The confidence developed among the community groups and the health extension worker has increased the number of pregnant women coming for ANC at the health post from 0% to 90% within 1 year. I would like to thank Global Health Workforce Alliance for providing me an opportunity to share experience of implementation of this model in Ethiopia. Any ideas, comments to improve the model or modify the model will be very much appreciated.